This may be the most important 15 minutes for you and your loved one's most important asset, your health. And yes, what I want you to do is spend the best $9.99 a month for yourself or $29.99 for your family. And that's a family of 3 or more. You deserve CompassionMD. Let me tell you why. You know, one of the worst things in life is you're not feeling well, or being told you have a diagnosis, a condition, or a treatment plan you don't fully understand. For you, for your loved ones, or not to mention for your child. That moment can stop your whole world. You're already dealing with the fear, the symptoms, the stress, and then you're forced into a healthcare system that's complicated, confusing, costly, and uncertain. And what do most people do? They wait, they guess, they Google, they hope they're making the right decision, they hope it doesn't get worse. But what if that entire experience of sick days, scary diagnoses, confusing treatment plans could be transformed for less than 50 cents a day? What if your healthcare journey could feel cleaner, calmer, and more certain because you had direct care, virtual direct care, a doctor who works directly for you, no middleman, no long waits, no surprise bills, no confusion, no feeling lost or alone, just compassionate medical guidance and world-class care anytime, anywhere. And here's the powerful part about it. Direct care doesn't replace the healthcare system. It enhances it. It works right alongside it, both without the stress or the bureaucracy. And studies prove it. They prove that you have fewer emergency room visits and doctor's office visits, on-demand access, better healthcare outcomes, lower healthcare cost, increased lifespan, lower micromort count, meaning you're 1 in a million chance of dying, and the priceless peace of mind. And here's what most people don't know. Even if you rarely use the doctor, just having direct access still gives you those associated benefits, because knowing a doctor works for you, not the system, brings clarity, confidence, and calm to every healthcare moment. And in this video, I'm going to show you how it works and why it works. Once you see it, you'll never look at healthcare the same way again. Let's face it, healthcare today, whether it's private insurance you pay for, insurance provided by your employer, Medicare, Medicaid, it's all confusing, costly, uncertain, and honestly scary. PPO, HMO, high deductibles, in-network, out-of-network, what's included, what's not included, copay, no copay, what facility can I go to, where can I go, emergency room or urgent care, appointment or wait it out, do you need a specialist or not? It's a maze, and you're expected to navigate it when you're stressed, worried, or in pain. And when something doesn't feel right, whether it's you, your child, or someone you love, what's the first thing you do? You turn to Dr. Google. You call a friend or a relative. You try to piece together memories or advice you once heard. And suddenly, your screen fills with the scariest possibilities imaginable. Your heart starts racing. Your blood pressure goes up. And now you're even more worried and overwhelmed than before. What should you do? Should you go to the emergency room, urgent care, schedule a doctor's appointment, or wait it out? Then more questions hit you. How much is it going to cost? Is it covered? Is your deductible met? Do you need a referral? Do you need pre-authorization? How long will you have to wait? Where do you go? Which facility is allowed? Or maybe you or your loved one already has a diagnosis and it scares you to death. Or maybe you or your loved one already has a diagnosis and it scares you to death. Is it accurate? What does this mean for us? Is the treatment plan the best one? Do I really need this surgery? Do I really need this medication? What are the side effects? Are there safer alternatives? We've all been there, or we love someone who has. And if we haven't, unfortunately, it's only a matter of time, because that's just the reality of the healthcare system and the reality of our bodies. There's something out there called concierge medicine, or also known as direct primary care. But most people don't have an extra $300 to $600 a month lying around to afford it, and that's on top of the regular insurance premiums. It was designed for the wealthy, for the people who could afford to have that doctor on call day or night, with no middleman, no insurance companies, no private equity firms, just you and the physician. Back in the day, that's the way care actually was. Doctors made house calls. Families knew their doctors. There was a real relationship, And that kind of care didn't just treat people, it had compassion for them. Real trust, real continuity, real compassionate care, the kind every family deserves. And then we had a thought. What if we could bring that kind of care, the kind that families used to have, the kind wealthy people paid $300 to $600 a month for, to everyone? What if we make it available anywhere, to anyone, at a price everyone could afford? What if we could use the power of technology, the strength of a compassionate nationwide doctor network, a simple subscription model, and the power of numbers to bring virtual direct care to every household in America without the high price tag? What if we could give everyday people the same level of access, the same peace of mind, the same direct connection to doctors the wealthy get, but for less than 50 cents a day? So we built it, and then we said, let's make it even better. First, this model has been studied by numerous independent organizations, and all have shown the same associated benefits from simply having a direct care program in place. First, on-demand access from anywhere in the world, anytime, 24/7. Improved healthcare outcomes, fewer visits to the emergency room or doctor's office, lower healthcare cost, increased lifespan, lower micromort count, your 1 in a million chance of dying, and the peace of mind knowing you have a doctor who works directly with you, which we call medical guidance. The Society of Actuaries wrote, direct primary care members experience a 53% reduction in emergency room claim cost, as well as approximately 40% fewer emergency room visits in general compared to those in traditional healthcare plans. Springer, Journal of General Medicine, wrote, we demonstrate that direct primary care practice can yield upwards of $25,000 in annual cost savings over the fee-for-service practice, while also providing more personalized patient care. NIH did a study. The minimum mean healthcare expenditure avoided by utilizing telehealth modalities is $1,171 per year, per family. 100% reported texting questions to their doctor, 93% sent pictures, 88% telephoned their physician. Vower Direct Primary Care wrote, fewer emergency room visits, reduced hospitalization admissions, and a decline in specialist referrals are some of the broader economic benefits observed with the rise of direct primary care. Haas Medical wrote, direct primary care members with hypertension are 12% more likely to have their blood pressure controlled than Americans on commercial PPO plans, 40% fewer emergency room visits, 53% lower ER spend. And SHRM, Society for Human Resource Management, under a direct primary care model, employers can offer a more flexible and cost-effective approach with lower avoidable utilization, fewer emergency room visits, reduced hospitalizations, and better chronic care management. That says it right there, and that's what we're bringing to you. Now let's hear what a few real testimonials about CompassionMD had to say. This is Eola Davis, and she is a 25-year-plus federal employee.
I actually found it to be spot on and excellent. We were able to meet virtually. I had my camera on, he had his camera on. I was able to tell my complete history and experience with my symptoms at present, but also that history, which, you don't always get these days. Oftentimes it feels that doctors are limited with their time. And so you have, this sort of sprint conversation in contrast to a marathon where you feel like you have to give the quick version and not the full picture. And so I absolutely feel like I was not only able but encouraged to share all of the history that I had experienced, especially as related to COVID. And I would imagine with any issue I had that it would be the same.
This is Ron Downing, another CompassionMD subscriber.
All right. Hi, Ron Downing here. Just started up ended up taking my first phone call with a doctor. It was awesome. They ended up helping me out a lot. So
About how long did it take you, Ron, to do everything from start to finish?
Probably less than 10 minutes.
Awesome. Thank you, sir.
All righty.
Would you recommend it to friends?
I will recommend it to friends.
All right, thank you.
Absolutely.
All right, bye-bye. Now let's hear what doctors are saying. This is Dr. John Karangi, practicing neuroradiologist, and Dr. Monique Gary.
We've got a whole piece behind medical guidance in it where, if you do have a provider, you've got a doctor, you've been seeing them, you've got whatever issue. But, as you know, sometimes treatment plans are confined by the insurance company, right? Or restrictions on your location. There's different things that come up, right? And so those individuals, those patients don't know sometimes that there are other options, right? There's other treatment options or there's other things that could be done. And just, if for nothing more than just reassurance that, hey, your course of action seems 100% appropriate versus, hey, there are other choices you have too. If you want to wish to explore those, we'll give that sort of medical guidance to individuals as well. So that's another piece that we've kind of layered in, which we found a lot of folks that are part of our programs now like, because, there's, unfortunately now when you go to the doctor's office, your doctor, you're kind of seeing patients fast and going through stuff. You got to get through a certain amount of people during a certain period of time. Mm-hmm. For us, it's like, okay, let us help reassure you and or give you some guidance into what you're doing and what's happening to you, because for a lot of folks, it's just how reassurance just helps, right? And you calm down, temperature goes down, and you feel a lot more comfortable saying, hey, okay, I feel good, I'm on the right course.
I love that you said that, because, especially in oncology, getting that second opinion and hearing something again can really help to solidify, because the first time all you hear is want cancer. And then when you get a chance to go and dissect it, exactly, Ricky, you go to another doctor and they say some of the same things and some of the same words and some of the same plan. It makes you feel, one, comfortable with the first doctor you saw that might be closer to your house, that might be able to provide care, closer to where you live. But it also helps to just reinforce, what the plan is, what the diagnosis is. Hearing it again, you can take an advocate with you. So that sort of second opinion consult is something that I think many breast cancer patients would love, because sometimes you got to travel really far to get to that next opinion. Right,
exactly. That's kind of, our thought behind a lot of it has just been that. I think obviously mentioned this. There's tons of places, there's tons of great doctors across the United States of America, and there's tons of places that don't have access, or it's too far to travel. You got to take time off for work, travel, stay in a hotel, et cetera, and a lot of this can be done remotely.
This is Dr. Evan Lewis, 25-year medical doctor.
I think it's, one of the great things, again, is people talk about the best thing since sliced bread, because the need for someone to be looking over and being readily available and able to provide some help is indeed what many people need these days, because it's become a more complex system to manage. And so having a tool like that is very much needed this day and time.
A mission that can help a lot of people. We're here to enhance the healthcare system, not replace it, not fight against it, but to work right alongside it, providing direct care that is proven, studied, and validated. And that's why I'm sharing this with you today, because once we saw the results, once we understood the need, once we saw how universal the desire was, we knew we had to bring this to the everyday person, not just big companies, not just the wealthy. Now imagine your life with this kind of access. Imagine having a doctor available anytime, day or night, whether you're at home, at work, or on vacation in the Bahamas. Imagine having a doctor in the middle of the night when your child spikes a fever, starts coughing, or something just doesn't feel right. And instead of panicking, you simply tap a button and talk to a professional who knows what to do. Imagine having a licensed physician ready to help you when you receive a diagnosis or a treatment plan you don't understand. Or you want to make a second opinion. We want a second opinion before making a medical decision. Imagine having a doctor to talk to when your mother, father, or someone you love is dealing with a medical issue. Someone who can guide you and calm you, explain the situation, and help you make the right decision. Imagine having a doctor when you just need a quick refill, even if you're in another city, another state, or traveling across the country. Imagine having a doctor who actually listens, who takes the time to explain everything clearly, who doesn't rush you, who works directly for you, not the system. No middleman, no insurance red tape, no surprise fees. Imagine having access to mental health hotline when you're feeling anxious, overwhelmed, stressed, or when someone you love is going through a mental struggle, and knowing you're never alone. Imagine saving $100, $500, even $1,000 on your dental care, vision care, and prescription medications simply because you have access to discounts powered by a nationwide network. Imagine having a doctor who can review your medical records and provide a documented second opinion when needed, giving you clarity, confidence, and peace of mind at some of the most important moments of your life. This is what your healthcare should look like. This is what direct care makes possible. And this is what CompassionMD gives you every single day. What do you get? First thing you get is your own HIPAA-compliant patient portal, a private, secure medical portal where you can schedule appointments on your time, view future and past appointments, see your medical records, upload documents and files or images, access dependent files and add dependents, have a secure video consultation with the provider, message providers directly, see provider notes and past provider notes. Manage everything for you and your family all in one place. This is your personal, secure health hub. You also get urgent care, and for a limited time, free consults. Primary care for a limited time, free consults. You get medical guidance, just a $39 consult fee. Mental health hotline, just a $69 consult fee. And the doctor oversight is included. You have on-demand care coordinators. That's your human support team and more. You're never alone. No middleman, no long waits, just real doctors, real help, in real time. And you also get the proven benefits of direct care, which the studies have shown. You get the on-demand access 24/7, anytime, from anywhere. Fewer visits to the emergency room or doctor's office. Improved healthcare outcomes. Lower all healthcare costs. Longer life. Increased lifespan. A lower micromort count. Your 1 in a million chance of dying. Direct access to your own doctor without the middleman. A real relationship with the same doctor. It's known as continuity of care. Or you choose to select a new doctor until you find the one you love. The ability to talk to a doctor about your loved ones through medical guidance, documented second opinions, or quick virtual medical guidance. Anybody in their right mind would want all these associated benefits. Of course they would. Of course you do. So we got some bonuses that are automatically included. We added dental and vision discounts powered by the Aetna network, because a lot of times these things are families pay for outside of their insurance, right? Bonuses automatically included. We didn't just build a direct care program. We added bonuses most families are paying for separately. Dental and vision discounts powered by Aetna. Prescription discounts. Patient safety and fair care council. Continuity of care support. 24/7 care coordinator access. These are all included automatically. Enroll now and unlock direct care. Get access to direct care now. Just scroll down just a little bit, click the button, whether you're a family or an individual, and instantly gain access to licensed doctors and all the associated benefits of direct care. You deserve it. And remember, for a limited time only, you're getting free urgent care consults. It's normally $29 per consult, and it's valued across the industry at around $99 per visit. Now free for a short window. This bonus will disappear without notice, so scroll down below, fill out the form, and subscribe now so you receive it. Warning, the free urgent care consults and primary care consults bonus won't last long. Act fast before the window closes. Again, here's everything that you'll get when you join today. Your own HIPAA-compliant patient portal, where you can schedule visits, view past and future appointments, access records, upload files, manage dependents, message providers, and have secure video consults all in one place. On-demand access to licensed medical doctors, urgent care, primary care, medical guidance, mental health support, specialists, referrals, and full physician oversight. Mental health hotline access. Talk to licensed professionals when you're anxious, overwhelmed, stressed, or dealing with an emotional concern. specialist referrals, and guidance. Connect with the right specialty with guidance from your care team. Dental and vision discounts. Lower the cost of cleanings, exams, glasses, contacts, and more. And prescription discounts, instant savings. You also get the Patient Safety and Fair Care Council, a guidance team that helps you protect you from unnecessary procedures, overbilling, misdiagnosis fears, and medical uncertainty. The 24/7 Care Coordinator access, real human support whenever you need it. Continuity of care, build a relationship with the same doctor, or choose a new one until you find the perfect fit. Documented second opinions, full written case reviews when you need clarity the most. Medical guidance for loved ones. Talk to a doctor about your family concerns, conditions, diagnosis, or treatment plans. Peace of mind, which is priceless, knowing a doctor works directly for you, not the system, for less than 50 cents a day. And right now, you're getting it for $9.99 per month for individuals, $29.99 per month for households of 3 or more. Plus, limited time free urgent care consults. Normally $29 per consult, and it's valued at $99 per visit. Now free. Take action now. Scroll down, click the button, and subscribe. This limited time bonus will end, and once it's gone, it's gone. Welcome to the CompassionMD family.